Parents here in South Florida are facing a difficult conversation with their children. Parents are dealing with their own fear and anxiety following that massacre as well.
Our Steve King joining us now in the studio. And Steve, you spoke with some experts in our area about what advice they have for parents when they talk with their children.
Felicia, that's right. I spoke with two experts, a licensed mental health counselor and a stress doctor, a psychologist here in Florida. And they say what's most important right now is letting children know they're safe and loved and that you're there to talk with them about what happened once the moment is right. But local mental health counselor Liza Piekarsky, who helped provide support in Parkland following the mass shooting at Marjory Stoneman Douglas High School, says for some kids, they might not be able to discuss what happened right away.
Everybody has their own grieving process, and maybe within the 24 hours of a significant tragedy, they might not be ready. It might take them a few days, it might take them weeks, right? But be mindful of some of those red flags that are presenting. Is the child isolating in his room and refusing to talk to anybody about the topic, which is not a typical behavior for this child? Well, that's a red flag.
Now, Piekarsky says when you discuss what happened with your child, you can express your emotions, but try not to appear too afraid or stressed in front of them. Speaking of stress, psychologist Dr. Terry Lyle says a general rule of thumb is if they're very young and they don't ask about the mass shooting, you don't have to discuss it with them. They might not know about it. Also, if they're young, you can discuss what happened and that they're safe, loved, and supported, but you don't have to expect a verbal response from them. He says the best way you and your child can deal with the fear of what happened is to be as prepared as possible and have a plan of action if you are ever in a dangerous situation.
Prepare, prepare, prepare. And if you are prepared, the fear seems to diminish on the act of something that goes wrong because you know what to do. The biggest fear is not knowing. If you know something is potentially going to happen, and it's not like you anticipate it, but you're guarded for it, when that happens, you know what to do. The worst fear is not knowing.
Now, experts say that if your child is showing a change in their normal daily habits or their behavior, you should seek further guidance from mental health professionals. Reporting live in the studio, Steve King, WPBF 25 News.